There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: what is the best treatment for high blood pressure? Answer by Ray Schilling. Treatment of high blood pressure has improved vastly after the Second World War with the introduction of diuretic medication and the subsequent introduction of beta blockers in the 1960s. This led to a significant prolongation of the life expectancy in hypertensive patients throughout the world. Further, with the introduction of home monitoring devices that allows a patient to adjust medication according to blood pressure readings, a patient can expect to add about 10 to 20 years of life over a lifetime. However, it is important to point out that despite that progress, about 30% of patients do not know that they are hypertensive and only 25% get adequate antihypertensive treatment. The following recommendations will be useful for most of the patients with hypertension, but you should seek the advice of your physician to ensure that you will get optimal antihypertensive therapy with a minimum of side effects. The objective is bringing T blood pressure under control with the help of medication. Blood pressure therapy is an ongoing maintenance program, not a magic cure. Do not stop taking the medication without the advice of a doctor, or you run the risk of a sudden stroke or heart attack. Steps for controlling blood pressure. Only very few people will be able to control their blood pressure by dietary changes, drastically reducing alcohol intake, less than 1 ounce per day, and restricting the sodium intake to less than 2 grams per day. It is safer to treat the high blood pressure with medication while changing lifestyles and habits and then reducing or phasing out the medication at a future date. I vividly remember a patient of mine who was in her 80s, was sharp in her mind, but also was resistant to the advice of taking medicine. Within only 2 months she got a massive stroke, from which she died within 3 days. Life is too precious to risk a stroke or a heart attack. Treatment of high blood pressure. Home monitoring. Here is the standard approach to high blood pressure. Treatment of high blood pressure. Individualized blood pressure therapy. Physicians need to switch from indiscriminate therapy to individualized therapy. In other words, every patient with high blood pressure has a right to the best therapy for his/her particular situation. We need to know about the side effects, which are all listed in the physician's desk reference book. The physician needs to balance the pros and cons and come up with the right combination, if necessary, to control the patient's blood pressure and bring it down to below 120/80. In patients above the age of 80 years, the limit is 140/90, although some cardiologists disagree and still want the blood pressure to go to at least 120/80. The patient on the other hand does his/her part by watching the lifestyle factors and doing the home blood pressure readings on a regular basis. There may be some weight loss necessary. Exercise may have to be introduced to improve the blood cholesterol levels. The physician will give you additional advice such as a low-fat, low-refined carbohydrate diet, and what to do and what to avoid. His advice is crucial, not only the medication. What counts is that you are comfortable taking care of your own blood pressure problem. You need all the help you can get, from the physician, from the medication, from your lifestyle changes. It is for your life. In this context, it is interesting to note that a group of Belgian cardiologists noticed that exercise alone could reduce blood pressure in people with hypertension by 7 points systolic and 5 points diastolic, 7/5 reduction. Researchers at Duke University Medical Center added the diet to exercise and there was a reduction of 16 tenths, 16 systolic and 10 diastolic. As Dr. Brian points out, both exercise and the diet are increasing nitric oxide in the blood, which dilates veins and arteries, just as the blood pressure medication does. The only difference is that eating beets, kale and green leaf vegetables and doing regular moderate exercise will not have any undesirable side effects, so try this first and add as little medication as you need on top of this. It is time that not only 12.5 million, but all of the 50 million, 100%, hypertensive Americans in the U.S. get treated adequately. The same type of reasoning applies to the rest of the world. First published there, http://nethealthbook.com/cardio. Answer by Roy Gillen. There are many effective ways to lower your blood pressure. The following is a summary of the American Heart Association (AHA) recommendations. Home monitoring. The AHA recommends home blood pressure monitoring for all people with high blood pressure. Track your blood pressure. Take control over your situation. Tracking your blood pressure helps you and your physician to understand your situation better and tailor your treatment. Try my app, My BP Blood Pressure Tracker. Click here to check it out. Wait, even a 10-pound weight loss can help lower blood pressure in overweight people. Overweight people are at risk for multiple health problems. Diet. Make smart choices. Try to follow the dietary approaches to stop hypertension. Diet. Eat more fruits, vegetables, low-fat dairy products, whole grains, fish and nuts. Limit consumption of red meat, sweets and sweetened drinks. Reduce sodium consumption. The AHA recommends no more than 2,300 mg/day, ideally less than 1,500 mg/day. In Western countries, most of the sodium comes from processed food and not from your salt shaker. You can estimate the amount of sodium in your food by looking at the nutrition fact label. Try to keep a healthy diet and make smart dietary choices as mentioned above. Potassium. Potassium-rich diet is important as potassium reduces the negative effects of sodium. The diet provides many sources of potassium. Physical activity. Regular physical activity has many health benefits besides lowering your blood pressure and is one of the most important things you can do to improve your health. The American Heart Association recommends for most healthy people at least 150 minutes of moderate intensity physical activity, e.g., brisk walking. Each workout should last at least 10 minutes and it is better to spread them throughout the week. Try to incorporate strength workouts at least 2 days per week. You should take it easy and progress gradually. Try to build a plan you can stick to and make it your routine. Walking is recommended as it is easy, fun and can be social. Alcohol. Limit your alcohol consumption to 2 drinks/day for men and 1 drink/day for women. Medications. Medications may have important role in your treatment. Remember that naturopathic approaches are not a substitute for medications. Most probably, your doctor will recommend adopting lifestyle changes along with your medications. Over-the-counter medication, OTC, always read their labels. Look for warnings regarding high blood pressure. For example, decongestants may raise your blood pressure. It is recommended that you discuss the topic with your physician and decide together on your treatment. Remember that a key to better control is a good doctor-patient partnership. Medical disclaimer: the comment contains general medical information. Do not use the information as medical advice. The information is not a substitute for medical advice. No warranties or representations are given in relation to the medical information. Please consult your physician if you have any questions about any medical matter. Answer by Julia Markov. Dangers F. Hypertension, R. High blood pressure, RWLL known. The QMHBN signs or symptoms. T. So-called silent killer and be wreaking havoc in her body, damaging her arteries and detaxing her heart. THRRMHNGUULD make T. Her lifestyle. T. Reduce high blood pressure. SMFTH will lower her blood pressure in a matter of weeks. Will THRMTK longer? TH include cutting her salt intake TLTHN 6 grams, 0.2 ounces, a day. Find out HWUN reduce TH amount of salt in her diet. Eating a low-fat, balanced diet including plenty of fresh fruit and vegetables. GT tips and eating Mr. Healthily. Being active road M tips but ding Mr. Exercise. Cutting DWN and alcohol GT tips and cutting down, including downloading a drinks diary MD keeping track of her drinking. Losing weight find out WHD or ideal weight IUing THBMI healthy weight calculator ND road advice but losing weight if you're overweight. Drinking L caffeine found in coffee, TND cola. Stopping smoking GTHL quitting. Ding TLT 9 hours F sleep a night of UN road M tips FR ding T sleep. SBRL medications NBA THL control high blood pressure. MN people NDTTK a combination F different medicines. TH medication recommended FRUT for will depend on your age and the ethnicity. If you're under 55 years of age you'll be offered an ACE inhibitor or an angiotensin II receptor blocker, ARB. If you're aged 55 or older, or you're an HMDF African or Caribbean origin you'll be offered a calcium channel blocker. UMNDTTK blood pressure medication FRTH rest FR life. But her doctor might BBLT reduce or stop her treatment if her blood pressure stays under control FRVRL years. High blood pressure usually is present for years before its complications develop. Ideally, hypertension is treated early before it damages critical organs in the body. A wonderful therapy to control high blood pressure given that control your blood pressure has helped many patients to get rid of this disease and lead a healthy life.